Welcome to our discussion on antibiotic duration after debridement and implant retention for early postoperative spinal implant infections. This multicenter cohort study, led by Tai et al. And the SPIRIT team, involves 10 United States academic centers, focusing on antimicrobial stewardship in musculoskeletal infection and spinal surgery. Early postoperative spinal implant infections affect 1 to 5% of patients, with rates expected to rise as procedures double by 2050. Patients endure chronic pain and repeated surgeries. While debridement with implant retention is standard, the optimal antibiotic duration remains unclear due to limited evidence and methodological flaws. Treatment failure is reported at approximately 30% across studies. This study is a retrospective multicenter cohort from 10 United States centers, focusing on early PS2I within 90 days. It uses a time-varying Cox model for primary analysis, conditioned on 6-week event-free survival. The primary outcome is treatment failure, adjudicated by ID clinicians. Secondary analyses include 12-week landmark and clone sensor weight methods to address biases. The cohort consisted of 499 patients with a mean age of 63.8 years. Males comprised 51.9% and 23.7% had diabetes. Lumbar involvement was noted in 67.7%, with posterior instrumentation in 95.4%. S. aureus infection was present in 43.7%. Median intravenous antibiotic duration was 43 days, with 79.5% undergoing single debridement. The overall treatment failure rate was 23.2% over a median follow-up of 3.2 years. Antibiotic duration did not significantly reduce failure rates, as shown by adjusted hazard ratio values in both the Cox model and 12-week landmark analysis. The chronic condition warehouse sensitivity analysis confirmed these findings, indicating consistent results across methodologies. Among 317 patients, 62 experienced failure after antibiotic cessation, with a median time to failure of 228 days. Polymicrobial infection increased failure risk, hazard ratio 1.81, p equals 0.030, while thoracic involvement reduced it, hazard ratio 0.45, p equals 0.031. These findings are exploratory and hypothesis-generating, without multivariable adjustment. Prolonged antibiotic therapy over 12 weeks shows no benefit in early prosthetic joint infection with debridement and implant retention. Shorter, individualized regimens are supported, considering high-risk features like polymicrobial infection. Prospective trials are needed to determine optimal antibiotic duration and roles of biofilm active agents. This study is the largest United States cohort on early prosthetic joint infection.